I would offer that I think we're using the wrong term when we say social determinants of health. It puts the onus back on the individual, as if it is the majority of it is behavior. It's, it's what I choose to do. Perhaps another way of just let's call it what it is. They're the economic disparities. These economic disparities create the health disparities that we see. They create and fester the poor outcomes that we see in education, in workforce, in job employment. So it's important for people to understand that because of the lack of equity and the economic disparities structurally, that everything that we try to do as a nation, and in particular in health, is adversely impacted by that. And until we address those issues, we're not going to move forward. And obviously, both the economic inequities that are tied and linked absolutely to racial disparities and the racism that really is a public health issue, which I really appreciate our governor here in Michigan calling it like it is. But having said that, then what are the antidotes that we bring to the table to begin to address it are so important. Mm-hmm. We were hearing consistently, well, my aunt has COVID and we don't really know where we're supposed to put her. Or my grandmother is in a facility, we can't see her, we're really worried about her, we don't know what to do. So people are trying to juggle the grief, the lack of understanding of healthcare systems, not being able to get through to the doctors. And as you already know, there's not enough primary care physicians, there are not enough nurses. And so in communities of color, where everyone doesn't have a medical home or Dr. Welby type, right, that you know by name, those kind of relationships don't necessarily exist. So that lack of continuity, that lack of relationships, the lack of having community health workers working closely with the systems to communicate and just, I will say, love on and support individuals going through these trials really help to exacerbate people, their social emotional status, let alone their health status. The George Floyd movement, our sister Breonna Taylor and others, helped more people to begin to say, wait a minute, a lot of folks have been talking about structural racism and how it manifests for decades. I think I'm beginning to see it because it was so glaring and clear with police brutality, but not just police brutality, a system of injustice. The whole system that supports that, from the unions to the AGs, et cetera. So now we see inordinate and high deaths of Black and brown people through COVID, and there's more understanding about, this isn't just something that's at a micro level. It exists because of systems issues. I've seen more awareness of that when particularly, we talk to students, and I think you see it even with more folks that are outside of urban areas. I think there are more people who live in the suburbs and even rural areas. I think rural areas are really getting it now. Because, unfortunately, because they have, in many cases, kind of bought in that this is something that impacts you, other people. If you vote a certain way or you look a certain way. But now we see, the hospitalization and death rates just zooming literally in other communities, particularly white communities across the country. And you see now activists emerging, or not necessarily activists, people emerging saying, there's something wrong with this system. How do we begin to fix it? So I think there's increased awareness about racism and this nation, about how it exists structurally. But I think also there's an understanding that poverty and lack of economic opportunity is the other demon that this country has to also address, because it undermines the quality of life that all of us deserve, particularly in the richest nation in the world. The more that we focus on prevention and create those prevention steps address and dismantle the historic structural racism that's there, attack and dismantle the economic disparities. I mean, the state of Michigan can literally make a hyper jump in 10 years, you know, instead of being we're at the bottom of everything, literally, whether it's, health or education, because we've allowed politicians to disinvest in the things that we know make a difference, whether it's quality housing, et cetera. So that's where I think the awareness of a more holistic prevention framework and bringing people together of goodwill to genuinely collaborate, break down silos, and so importantly, and this is where, for certainly the work that I do with DPN, is that we're saying families have to be part of the co-design of these systems and their repair. It is about us reimagining what is our best possibility and then getting busy to create the policies and the funding systems to address that and to do it in an equitable way.